So good morning, all. My name is Ranya Chakra, and I'm a pediatrician at Rock Hill Pediatrics in Rock Hill, South Carolina. So I want to start off with a story. It was a Friday afternoon in October, and one of my last patients of the day was a 15-year-old male, and he was presenting for a well adolescent exam. So usually during those well adolescent exams, we assess physical, mental health in our kids. And then we got to the part where I asked the parents to step out of the room so we can have a frank discussion that's open and confidential without the parents there. So usually my teens say, oh, we're good. I don't really have anything to say or talk about. So of course I have all my questions prepared. So we talk about drugs, sex, alcohol, mental health. I ask them, do you smoke? No. Do you vape? No. Do you jewel? Yes. So how much are you jeweling? 1 to 2 pods a day. Oh, well, as many of y'all know, that's nicotine equivalent to 1 to 2 packs of cigarettes per day. And I have really struggled to treat this dude due to the severity of his addiction, as well as his reliance on tobacco products like e-cigarettes. His mental health is suffered due to this as well. I'm gonna let that sit there, and we'll come back to our young man in a bit. And just to point out this picture I have here on my first screen, this is like an iQuote setup. This is at the Seal Creek Mall in Charlotte. And I went there to go return something, and I walk in and I see that iQuote stand. I'm like, that was not there. That is new. And I was there just a few months ago. And I'm like, not good, not good. Okay. And my next slide. So here in South Carolina, the 2019 data showed that 30% of high school students were reporting current use of any type of tobacco products, with e-cigarettes or vape being the most commonly used amongst our youth in South Carolina. This really makes our job to screen for tobacco use that much more important. And I have kids in my clinic as young as 12 or 13 who have vaped. It is my mission to keep these kids from becoming future consumers of tobacco products. Therefore, the pediatrician's role in smoking prevention is so very important. Not only do we take care of our patients, but we also take care of the whole family. Smoking cessation and prevention really starts with the first appointment after our baby's born, their newborn well check. We ask about combustible cigarette smoking and e-cigarette smoking from the first newborn visit, because parental smoking is the main source of a child's secondhand smoke exposure. When parents quit smoking, the adolescents are less likely to start smoking. And parental counseling by a child's physician increases rates of parents attempt to quit. We really have a strong role in the health of the family unit. Most parents really see their child's provider very frequently in those first 2 years of life, with an average visit of 10 visits in those first 2 years. They probably see them more than they see their own physician, not to mention while many kids are covered by Medicaid, a lot of their parents may be uninsured, so pediatric clinicians may be their only source of counseling. So this is really where we can make a difference in our kids' lives through caring for parents' health and focusing on child as a primary beneficiary of smoking cessation. So, well, what about those adolescents? I just wanted to quickly think about this quote from Dr. Judy Groner, chair of the AAP section on tobacco control, and she's the former chair. The people who use Juul don't consider themselves smokers, and they don't consider themselves vapors. They use the term Juul, and if pediatricians aren't aware of what Juul is, they might not even ask the right question. And I think a lot of our speakers this morning have highlighted this exact topic. So it really just shows how the tobacco industry has adapted and mutated, because, Juul is no longer prevalent as it was a year or two ago due to new lawsuits, bans of flavored products, but the tobacco industry is smart and they know how to hook our kids. So the new thing is disposable vapes like the puff bars. So it's really important for you all to know the e-cigarette lingo, and just kind of to throw a few out there, e-cigs, pens, vapes, e-cigars, e-hookah, mods, personal vaporizers, Juuls, juuling, puff bars, amongst many others. So, in our practice, we use a screening tool to assess the level of addiction, and that's something I recommend for people who are trying to focus on smoking cessation and counseling in their clinic. So, utilize these tools. So you have a CRAFT plus N. If you're aware of the CRAFT screen, in general, this is basically a modification to include a question on vaping. It's just 4 questions. If everybody's says, oh, no, you can stop there. Now, of course, if you say, oh, actually, I do in one of these, you keep going, and it's a little bit longer. So it's a good quick screen for us. Also, there is a modified version of the Fagerstrom tolerance questionnaire. And then the dependence scale for assessing e-cigarette nicotine dependence. And I use a CRAFT plus N in my clinic, and like we talked about, it basically builds on the CRAFT screen. and adding an extra question on vaping. So I want to take you back to that story about the 15-year-old male. So we're in our weld exam and he is telling you that he's juuling, going through about a pod a day. So what do we do next? How would we approach him? Well, by talking to teens about nicotine cessation using the 5 A's. You ask your teen about their tobacco use in the context of routine screening. So using their well checks for that. You normalize that discussion. Use their language, use words teens will understand, and also ask them about tobacco use amongst friends and family. If the teen is using tobacco, even just once in a while or like last year, talk to him or her about that use. If they're using it now, once in a while, talk about stopping. Be clear, be personalized. Explain that the stopping tobacco is an important way to protect your health and let teen know that you're there to help him. Also, it can benefit the teen's other interests. So as people have touched on already, it improves your athletic performance, allows the teen to save money on other hobbies, activities. And really give a message that resonates with our teens, explaining that it's good for your health. Quitting will make you more independent because you're no longer, dependent on that nicotine. Then ask the teen if he or she is ready to quit tobacco use. So assist them if they are ready to quit by setting a quit date, and avoid major stressors like final exams. But make sure you talk to your teen or your adolescent and anticipate those challenges that may set the patient back. Identify strategies for success. So the most important thing I think is finding a social support from friends or family. So finding that support person that they can go to if they're feeling the cravings. Then, of course, it's really important to follow up afterwards. So talk with a teen by phone, text, email, if that's something that you're doing, you're giving it out to your patients, or in the office to see how their quit attempt is going. Just reassure them relapse is common and support from the provider can really help a teen learn from relapse and lead to eventual success. This is actually a poster I use in my office, which shows the 6 benefits of being vape-free in a very visually appealing medium. This came out in the AAP's recent journal. And I have some copies in my room, and it just tells you, well, it's supposed to be appeal to the youth by you're taking care of your health. You're saving your money because vapes are super expensive. You're taking back control of your life. You're being a good friend. You're doing better in school because we definitely see a decrease in grades and school performance on these drugs, and feeling good about yourself overall. I also provide resources in our clinic for our teens struggling with nicotine dependence, such as, using the Smokefree Teen, This Is Quitting, the 1-800-QUIT NOW, South Carolina Quit Line, this texting, Ditch Juul to 88709. And of course, I recommend local resources in the community, like we have Keystone here in Rock Hill, which has outpatient treatment classes, behavioral counseling, CBT, to help their quit success. We really need to tackle e-cigarette use in our pediatric population early so we don't get another generation addicted to nicotine. As pediatricians, we have a responsibility to counsel our adolescents about substance abuse, including e-cigarettes. In addition, we can accomplish this by reaching out to our lawmakers and advocating for children's health. So as in public policy to protect children from tobacco, nicotine, and tobacco use, protecting children from tobacco products is one of the most important things that a society can do to protect children's health. And with that, I believe I end my quick blurb.
Thank you so much, Ranya. You can unshare your screen or stop sharing. So there were a couple of questions. I think this was to Donna while you were talking. Do you ever hear from parents that they think vaping is safer than smoking or smoking weed, so they encourage vaping?
Yeah, we hear that a lot. And it's really unfortunate because, again, the message of vapes being safer than smoking cigarettes is still out there, and people don't really understand that safer does not equal safe. So we hear that a lot from parents, and it kind of goes back to what I was talking about earlier when parents are calling and asking to get the vapes back because they really believe that this is a safer alternative and it's going to keep their kids from smoking cigarettes or smoking weed. So it's like, this is a better alternative. So that is something that we hear a lot, unfortunately.
Okay. Heather Johnson, she was referring to a TV show called Columbo, C-O-L, Columbo. Katie Wynn has a question for Dr. Chakra. Although the use of NRT or other FDA medications are under study for those under age 18, do you as a pediatrician ever consider NRT or other cessation meds for your pediatric patients who smoke or vape?
Actually, yes. So while it's not necessarily FDA approved, it is safe to use NRT products in children. The benefits outweigh the risks, but you have to provide a prescription for kids under the age of 18 years old. So the American Academy of Pediatrics really does help support us through this and has come out with a recent educational toolkit, which has all the different treatment modalities, which actually also includes Chantix and Wellbutrin as possible treatment strategies for kids. And it guides us on like dosages and how to educate the patients on a proper use. Because I feel like a lot of the times people say, oh, those nicotine stuff doesn't work. Well, you're not using it right. So let's educate you on how to use it. So it's definitely something that I consider in my clinic. Not gonna lie, I haven't really done it yet because it is a little bit more daunting, but we do have resources in the community to help as well.
Okay. Ranya, I don't know, can you see
Chat box?
the chat box?
Yes.
The question about the scales for asking?
Let me see.
Why not ask if the kids can just stop using?
Let's see. Yes, so they are also used for nicotine for vaping. They need to be for both. The AAP has kind of utilized all three of these scales in order to screen for tobacco and nicotine use through either combustible cigarettes or e-cigarettes. Does that answer your question?
Okay.
And who makes
There was a question. There was a question about the 6 things poster. Is
Yeah.
that evidence? Do you know if that's evidence-based and where it was researched?
I am not sure. The AAP put that out in their recent, just like had a little printout. I know a lot of the research I've done too. When I've looked into things with the 5 A's, especially as a way to use motivational interviewing to talk to teens about stopping their smoking. They've also using those personalized messages, trying those to get kids, oh, hey, you take your life back, take control of your life back. Just things to what's the word I'm looking for, to appeal to teens.
I have a question that applies to both of you. Where is the line with youth who are heavy users and they know they're heavy users to understanding that addiction is part of the problem? How do they know whether they're just heavy users or, hey, I'm addicted to this?
One of the things for me, like when I'm seeing an adolescent and we're talking about use versus addiction, I will just give them the criteria that's in the DSM-5 and we'll just kind of go through that. So the DSM-5 is the criteria that we use to actually make a diagnosis of a substance use disorder. And it's on a spectrum. So they either have mild tobacco use disorder, give me moderate tobacco use disorder, or severe tobacco use disorder. And I will just go through those criteria with them so they can understand. And it's based on their information that they provide to me. So it's not my perception or my thoughts or beliefs about what they're doing. But once they answer the questions, I go through with them and say, hey, this is how you answered this. So let's look at where you fall on the spectrum and how we can get you, to move in a different direction.
Okay, thanks. Ranya, would you add anything to that?
No, I think exactly what Donna said. I echo that.
Okay. My other question goes to parents, and I'm not sure, Donna, if you interact with parents as much as Ranya would, but is there any particular breakthrough that you have seen helps parents grasp, oh, I really need to take this seriously and I really need to encourage or support my child to quit vaping, versus the casual attitude of, oh, it's not as bad as cigarettes, or that thing? Have you seen anything that successfully moves parents forward to engage them and wanting to help the kids quit? Ranya, you can go first on that one.
Okay, so actually it's really a good point, because during all our well visits, whether they're young children or older adolescents, we talk about anticipatory guidance. And so I really feel like adding a little blurb or asking a family, have you heard about this? I've heard about vaping. This stuff is in the news about e-volley or the vaping associated lung injury. just providing that anticipatory guidance and adding in and normalizing it as part of your well check exam. Like you're talking about gun safety, you're talking about summer swim safety, you're talking about growth development, just adding that in just makes the teen feel, okay, yeah, she thinks this is really important. And the parents like, okay, I got to start asking for this and open the conversation with my kid at home. So yeah, definitely feel like it's really important to talk to the parents and get them involved in talking to their teens as well.
Okay, thanks. Donna, would you add anything?
Yep, I completely agree with that.
And Ranya, we're back to NRT and using it on nicotine addicted. I know you spoke to it a couple minutes ago. Maybe you want to add some more.
Yes. So I have recommended it for a child under the age of 19, I believe, the 15-year-old, basically. He's been my trouble child. I've had a really hard time because his parents are like so obliging of his nicotine use through vaping as well as marijuana use. His friend had committed suicide recently. He had a lot going on, and this was his way to self-medicate. And so I talked to him about Keystone, which is that substance abuse center in Rock Hill, but I also recommended NRT, and I actually did start him on Wellbutrin. He was not interested in either Wellbutrin nor the NRTs. So it's been a little bit more of a struggle, but I have definitely recommended it to a few patients who are definitely like him, really badly addicted.
Another question I have, which is sort of ongoing, and you both have spoken to it a little bit, but in terms of parents of teens, and there's so many issues that are priorities, whether it's school or whether it's college prep or whether it's a sports team or all the things that parents of teens are juggling. Is there any particular way that helps parents get to prioritizing this? And I mean this in a little bit of a slightly different way than the way I asked it prior, but is there a way to get parents to move it up in the priority scale in terms of what they do give their attention to with their kids?
So I think the fact that it's been in the news recently, or, you know, COVID, of course, took a little bit of back burner for it, but I mean, or made it on the back burner, but because it's been on the news and so prevalent, I think that in itself will bring more attention and highlight the importance of talking to your teen about vaping, and just maybe opening that conversation before you even know that they're vaping or that they're even thinking about vaping, to kind of prevent them from starting, or maybe let them kind of confide in the parents, to know the parents are like a support there for their kid. Because I tell my kids all the time, your parents love you, they're not gonna be mad at you, they want you to be safe. And so to do that, she's got to have an open conversation with them. And, you know, just like with gun safety or swim safety or summer safety, anything, vaping should be just part of your usual routine when you're talking to your teens and their parents in the office.
Okay. Before we close up this panel, does anyone have any more questions about Donna and Ranya's face-to-face experience with teens and parents and vaping? Oh, certainly appreciate your time. I don't know, maybe each of you wants to give us just a sort of a concluding thought about all of this. Megan, why don't you, excuse me, so many Megans around today. Ranya, why don't you go first? Do you have sort of a wrap-up statement you'd like to share with everybody?
Yeah, so from the beginning of the presentations today, I was like, oh, this really all flows really well together, and we could keep building and building on the topic of vaping and vaping cessation and counseling in our teens. And I think it's really important, if you are a parent, if you are a healthcare provider, if you're a counselor, mental health provider, all that, just know like you have the power to make a difference in the kid's life, whether it's in the office, whether it's through the school, or even an advocacy at the level of advocacy at the State House in Columbia. You have the power, and nobody is too small or too not important to make a difference. And so do what you can, and just make it, be open about it.
Well, thank you so much. Very encouraging. Donna, what would you like to say and wrap up?
Yeah, I think in addition to what Dr. Chakra was saying, it's just being open, being relatable. If there's a message that I like to push more than anything, it's educating ourselves so we can educate others, and then just being relatable in those conversations. You know, one of the things I didn't mention was just our body language. You know, how we talk to kids matter, and how we approach them matters, because it's the difference between whether or not they're going to open up or shut down. So, you know, just being open, being relatable, learning all that you can about vaping so you can pass that information on and have some really great discussions with others.